This is Brad, and this is my submission for the ankle case study. So my initial hypothesis for this case is that she has an ankle fracture due to the mechanism of injury. It's very possible that she could have fractured an ankle landing awkwardly on her when she was jumping on the trampoline. She was unable to walk without pain immediately following that incident, which I think there's a little room for interpretation here. If she's walking normally and she's experiencing pain, I would maybe lean towards um, a sprain, like it says in the first sentence. But if she's trying to avoid putting any weight on that foot, then I would more suspect an ankle fracture. And just to err on the side of caution, my initial hypothesis is a fracture. And then similar to that, she has a 10 out of 10 pain when she tries to run or jump. So then, since I do suspect a fracture, I would include the Ottawa ankle and foot rules in my examination. And if I do find any positives, then I would stop the examination and refer for imaging so that I don't make anything worse. And if they're all negative, then I would continue screening out other possibilities. So I would measure swelling with the figure of 8 tape measure method that we learned. I would observe her gait to see if there is any abnormal weight bearing through the limbs. Those two are the measuring swelling and gait observation I would do along with the Ottawa foot and ankle rules. But then, yeah, if I find negatives with those, then I would continue screening the ankle with active passive range of motion and overpressures. And then I would do some special tests for ligament integrity. So the anterior drawer and medial talar tilt, which would assess those lateral ankle ligaments, which are the most commonly injured ligaments of the ankle. I would also include in my examination briefly looking at the knee and looking at the other leg, because even though she didn't complain about those, just imagining a little kid landing awkwardly on a trampoline, that it's very possible that other joints in the other leg could be involved. So I would do maybe a brief screening of the knee and the other leg. If I do find anything abnormal, then maybe go more in depth. Initial impairments that I would expect to see kind of separated these out into the ICF model. So like body structure and function impairments, limited strength, limited range of motion, activities that might be limited are walking, running, and jumping. And then she might be limited in her ability to participate in school tasks, like walking in the hallway, stairs, if there are any stairs in the school, participating in recess, or participating in any sports. And then after 8 weeks, I would probably expect to see still some participation restrictions. I wouldn't expect her to be going back to the trampoline park to be jumping around in there, or playing sports at a normal pace if she is an athlete or participates in sports. And then for my plan of care, again taking my hypothesis of an ankle fracture, the article by Sue recommended treating a low-risk ankle fracture with a walking boot, and immediate weight bearing is tolerated. But so I don't know if she would be seeing physical therapy right away, but whenever she does come to physical therapy, then I would address any strength or range of motion deficits with gentle exercise which is what this article by Lynn recommended. Manual therapy can be used to improve motion, which I may choose to use that, but wasn't shown to be any better compared to exercise. So I would include some Therax to address those deficits, and then also provide patient education on what weight bearing is tolerated means. So early weight bearing is good, but I want to make sure that she's not pushing past her limits of tolerable weight bearing, but also getting her to weight bearing, not avoiding bearing weight on that limb. And then after 8 weeks, use more therapeutic activity to address functional limitations. So gait training, especially if she had been wearing a boot for a while, getting used to walking again without that boot. Proprioception balance, which might be impaired with having her ankle immobilized. And then with those therapeutic activities, I would want to try and incorporate activities that she's interested in. So if she does like jumping on the trampoline, maybe not, maybe like marching on a trampoline or something, but not quite jumping yet. And then after 8 weeks, progressing to those higher level activities that she likes to do. So those are my thoughts on this ankle case study. Thanks for listening.